Hey everybody, it's Dr. Eric Balcavage, and we're here for the first edition of Metabolic Monday. And today, on the first edition, we want to talk about antibiotics and how they can reduce your health, okay? So, what we know about antibiotics, and many of us have taken at least one round, many of us have taken multiple rounds of antibiotics, is that when you take an antibiotic, it can disrupt or reduce the microbiome, which is the organisms that we typically find in our GI tract, by as much as 90%. And when you decrease the microbiome by 90% with a round of antibiotics, the question is, what happens next? Well, once the antibiotic goes away, that microbiome will grow back. The question is, what grows back? Will it be a nice, healthy microbiome, or does that microbiome grow back in what we call a dysbiotic state? We have overgrowth of types of bacteria in the GI tract that can become problematic. And what we typically see is, even with one round of antibiotics, that we wind up with gut dysbiosis and a cascade of problems that develop after a period of time of taking that antibiotic. So let me kind of walk through this. If you take a round of antibiotics, and most of us have taken multiple rounds, but let's say you take one round of antibiotic, that'll decrease that microbiome by about 90%. It results in the production of sialic acid as from the human body, but when the microbiome decreases by 90%, the gut becomes more alkaline. And when the GI tract becomes more alkaline, then species that thrive in this alkaline environment are going to have a tendency to overgrow. Things like Bacteroides will have a tendency to overgrow. And so when these overgrow, they produce something called succinate or succinic acid. And that succinic acid can then feed other commensal bacteria. And commensal bacteria are just bacteria that are commonly found in the GI tract. And when it feeds these commensal bacteria, these bacteria can now overgrow, and when they overgrow, they can actually become infectious or pathogenic. If there wasn't all the succinate, they may still be there, but they may not be problematic. But when these organisms start to overgrow and they become infectious and they start damaging the gut lining and they become pathogenic, they disrupt the mucus lining of your GI tract. So that kind of lets the bacteria and the organisms get closer to the intestinal cells. This can result in a decrease of something called your secretory IgA system, which is the immune system of your GI tract. Then that kind of takes down the guard, and it allows these organisms to create more damage, more inflammation in the GI tract. And we can start to see signs and symptoms of that when we have inflammation in the GI tract, and we can notice it as things like gastroenteritis. We can notice it as increased histamine responses. We can notice it as other symptoms as well. The other thing these things can do is they can start to cause leaky gut syndrome. And leaky gut is the damage to the junctions between the intestinal cells. And when those junctions between the intestinal cells become damaged, there's an opening which allows bacteria and organisms and their toxins to get out of the gut and into the body proper and create problems. We see the increased production of food intolerances. The immune system loses tolerance to some of the food proteins, and that drives food intolerances like gluten intolerance and dairy intolerance and a number of others. We can start to develop increased or decreased gut motility. Both aren't good, and this has now been termed irritable bowel syndrome. We know that when we have this process going on, it can lead to autoimmunity and loss of tolerance to our own cells and tissues, especially in the gut, but outside the gut, especially the thyroid gland. It can lead to intestinal symptoms, gas, bloating, pressure, reflux, and it can also lead to extraintestinal symptoms like asthma and allergies, skin disorders, acne, high blood pressure, chronic joint pain, brain fog, all kinds of symptoms. And then eventually it can lead to GI diseases like celiac, Crohn's, colitis. But it can also lead to extraintestinal diseases like Parkinson's and Alzheimer's and cardiovascular disease, thyroid disorders. And one of the things we suffer with the most is arthritic conditions. The challenge is this doesn't happen like a week or 2 weeks after an antimicrobial treatment. This can take months, years, or even decades to fully manifest as a GI disease. But these things can develop over that time period, and you don't even realize because these things are happening weeks, months, or years after a round of antibiotics, that the antibiotic really set the stage for it. Most of us don't take one round of antibiotics in our lifetime. We wind up taking multiple rounds of antibiotics. So what do? I mean, if you have an infection, you have to take an antibiotic. What should you do? Well, what we know is that the best thing to do, especially in this situation, is to try and prevent the GI tract from becoming too alkaline. And if it doesn't become too alkaline, then we're not going to get the overgrowth, and this cascade may not start. So one of the best things to do if you have to take an antibiotic is to take something like Saccharomyces boulardii or spore-based probiotics like Megaspore, which can then prevent the GI tract from becoming too alkaline and inhibit and stop this whole cascade from occurring, okay? So hopefully this first episode of Metabolic Monday helps. We're talking about antibiotics and how antibiotics, even one round, can reduce your overall health. All right, take care and look forward to another Metabolic Monday.